Patient is breathing. Circulation is intact. The scene is safe for the patient and myself, and for me to assess the patient. Can you please state your name?
Chad Hauser.
And your date of birth?
5/13/74.
Can you tell me what today's date is?
May the 8th, 2020.
And what we're doing today?
An assessment.
Okay. I would perform hand hygiene, put on gloves, and I'm going to start assessing vital signs. Okay, I'm going to start with your pulse. I assessed pulse for 30 seconds and I assessed respiration for 30 seconds. I would take the patient's blood pressure using an appropriate size blood pressure cuff and my stethoscope. I would take the patient's temperature orally and then do the patient's oxygen saturation, and then I'd take their height and weight, and then, yeah. And so, let's see. Skull is a normal size and shape. No unusual features of the head or face. No involuntary movements. Okay. Is it fine for me to palpate your head?
Mm-hmm.
There's no masses. Any tenderness?
No.
No, there's no dryness or scaling of the scalp or of the hair. The hair is fine, brown. No signs of hair loss. I'm going to take the temperature. Okay, temperature is normal. Okay, can you close your eyes, please? Tell me where you feel the cotton ball.
Forehead, nose, left cheek.
Okay, and then can you push against my hand? Push against my hand. Can you follow my facial expressions? Okay, and then I don't see any other abnormalities of the face. The eyes have no inflammation, redness, no signs of jaundice, no drainage, no flaking of the eyes. Eyes are symmetrical. I would take the patient's eyesight using a Snellen chart, using both eyes open, and then the right eye, and then the left eye, and then I would dim the lights. And would you look forward as I shine a light in your eye? Okay. Can you look at the tip of the pen light, and then look at the poster? And then back to the tip of the pen light. Okay, can you look at the tip of the pen light? Okay, and can you look at the tip of the pen light and follow it without moving your head? Okay, now can you close your left eye? Can you cover it? Okay, tell me when you see my fingers.
Okay.
Other side.
Okay.
Okay. Now I'm going to assess the ears. Ears are a normal size and shape. Normal temperature. Do you have any tenderness?
No.
Any tenderness?
No.
Tenderness?
No.
Okay. No inflammation, redness, drainage, bleeding, some cerumen present. No inflammation, redness, no lesions on either side. No drainage, bleeding, some cerumen. Do you get tingling in your ears?
Yes.
Both of them?
Yes.
Okay. Can you cover your left ear? Can you repeat what I say? RL5.
RL5.
Other side? L12.
L12.
Okay, now can you sit onto the bed? Okay. I'm going to palpate your sinuses.
Okay.
Tenderness?
No.
Tenderness?
No.
Okay. The nose is symmetrical, good size and shape, within normal limits. Inner nose is pink, moist, no signs of septal deviation, inner or externally of the nose. Can you breathe in? Breathe in. Okay, can you close your eyes? Can you tell me what you smell?
Coffee.
Coffee, yes. Okay. Now I'm going to inspect your mouth. Your lips look moist and they're pink. Okay. Can you show your teeth? Okay. Yellowing, some yellowing. Let me look inside. Inner lips are good, intact, moist, or pink. All teeth are intact, no signs of cavities, no plaque. Cheeks are pink, moist. Can you put up your tongue? Okay. Can you stick out your tongue? Tongue is pink, moist, no cracks present. Okay. Can you stick out your tongue? Okay. Gag reflex is intact. You open wide. Okay. Uvula is centered and rises. No tonsils are present. Soft and hard palate are pink and intact. Can you please close your eyes? And can you close your nose? Okay. Can you grab what's in here and tell me what it tastes like?
Milk.
Yes. Okay. And then I would change my gloves and perform hand hygiene. Okay, I'm inspecting the neck for symmetry. No swelling or inflammation. Can you open and close your mouth? Okay. No clicking or crepitus. Okay. Do you feel any tenderness?
Mm-mm.
No enlarged lymph nodes. Can you swallow for me? Okay. I don't feel any enlargement of the thyroid. Trachea is centered. Can you look to the side? Other side. No signs of jugular distension. I'm going to feel your carotid pulse. Okay. And I'm going to listen for bruits, okay? Okay. So there's no bruise, okay? Now I'm going to ask you to put your head to the sides of your... Okay, now can you turn? Okay, can you put your head back? And then put your... Yes, there you go. Okay. Can you show it against my... Okay. And then can you turn to your side so I can inspect your chest? So anterior posterior diameter looks normal, no signs of barrel chest. Okay. He does not seem to have any effort in breathing. He's not using any additional muscles for breathing. Chest rising is equal and symmetrical. Okay, I'm going to palpate. Okay?
Okay.
Okay, now the front. Okay, now I'm going to auscultate your lungs. Can you breathe in and out with your mouth? Okay, so all your lung sounds are clear and normal, no adventitious breath sounds noted. Okay, can you sit forward, please? So I inspect the heart and pericardium for any pulsations, and there aren't any. I'm gonna palpate. Okay, and can you lay on your side? And then I take your abuccal pulse for a full minute. Okay, now I'm gonna listen for bruits. Okay, so you don't have any bruits, and you have both S1 and S2, and no extra heart sounds. Okay, can you sit up, please? And I'm going to check your skin turgor, okay? Skin turgor is intact. Can you stand up for me, please? And then can you pretend you're diving? Okay, spine is aligned, no spinal deformities. Okay, can you sit down, please? And then can you lay down on your back? So then I would assess the breast for any dimpling, retractions, any tenderness, any inversion, eversion, and stuff like that. And then I would assess the nipple for any discharge and tenderness. Do you have any tenderness of your breast or nipples and discharge?
No.
No, okay. Any masses?
No.
Okay. And then can you please sit up? Okay, and then I'm going to assess the upper extremities for color. Color is within normal limits. I'm going to check the temperature of both. Okay, temperature is within normal limits. Okay, let me take your pulses. Okay. Okay. No signs of muscle atrophy, no spasms. No signs of muscle atrophy, no spasms. Okay, can you go like this? Can you go like this? Can you go like this? Okay, can you touch your fingers? Okay, and then can you go like this? Okay? Okay, now let me see your nails. Okay, all cuticles are intact, nails are cut short, nails are pink and smooth. I'm gonna check cap refill. Okay, cap refill is intact in all of them. And then your pulses are bilateral. Okay, now can you please lay down? Flat. Okay, so I'd be assessing the abdomen for any pulsation, any distension, bulging, or anything like that, which there isn't any. And then I would also pulsate all the quadrants. Okay, and then I would listen for a bruit. Okay, no bruit. And then there's no subpubic distension to indicate bladder distension. And then, okay, I'm going to palpate and then tell me if you have any tenderness, okay?
No. 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 No.
Okay, and then your umbilicus is midline, okay? Then now I'm going to check your lower extremities. Color and temperature normal, within normal limits. No signs of muscle atrophy. Can you feel me touching?
Mm-hmm.
Can you feel me touching?
Yes.
Okay, so no peripheral neuropathy. No signs of DVT. No signs of edema. Do you have any tenderness in your legs?
No.
No? Okay. Other side. Okay, there was no swelling, pain in any of the joints. There was crepitus in both knees. Did you have any pain while doing that?
Just the right knee.
Okay, and then I would assess femoral pulses. Let me check your pulse. There you go. Okay. Okay, and then I'd assess all of these for 30 seconds, and they're all bilateral. So the feet are both symmetrical, color and temperature are within normal limits. Can you feel me touching your feet?
Yes.
Okay. And then the toenails are cut on both sides. They're both pink and smooth. Cap refill is intact on all of them. Okay, now let me look for any signs of ulcerations or breakdown of the foot. Okay. Okay, and Mr. Hauser, can you get up for me, please? Can you stand straight with your feet together, put your hands crossed over your chest, and close your eyes? Okay, and can you walk toe to toe? And then can you walk from here to there on your toes, on your tippy toes? Okay, can you sit back down? So there was no edema or signs of DVT in the legs either. Okay, can you lay back down? Okay, so I would change my gloves and perform hand hygiene. Okay, and Mr. Hauser, do you have any tenderness, any swelling or discharge from your penis or urethra?
No.
Do you have any masses or tenderness in your vas deferens or testes?
No.
Okay, so for females, I would check the labia and clitoris for inflammation, tenderness, and symmetry, and I would check the urethral opening and the vagina for discharges and lesions. Okay, and Mr. Hauser, do you have any hemorrhoids or fissures, fistulas, or lesions in your anus? No? Okay. And Mr. Hauser, you have successfully completed a head-to-toe assessment. Thank you for your time.